Hi, I'm Dr. Joseph Bogart in Parkland. This is Brock, and Brock comes to see us because of some cranial distortions and wellness that we're doing as far as adjustments on him for. Today we're going to go ahead and adjust him with a couple different techniques, KST being one of them, SOT being the other, as well as some other diversified adjustments, and you can see what it's like for a little child to get adjusted. I was also informed that Brock has been dealing with some breathing and respiratory issues that we're going to be helping him with today. So we're going to take a look. First we're going to look, check his tailbone, and he has some issues with his tailbone down here, especially now that he's a year and he's starting to walk around, stand up on his own. This is getting knocked out of place. This is an arthrostim. This is a very gentle tapping device that we use to adjust misaligned bones and put them back in place, as well as on pediatrics, but also on adults. It feels very soothing and it's very gentle. So that's for your tailbone, buddy. Let's see what's going on in your upper back in here. Yeah, you definitely have something going on here. So we're going to use the arthrostim again and adjust this area here. He likes that. Does that feel good? You like that? Does it feel good? Yeah? Okay. That's your spot, buddy. That's your spot. That's your big time problem area for you. Let's go ahead and turn Brock over onto his back. Okay, and one of the things that we're going to do, and although this looks a little bit barbaric and a little bit strange, we're going to swing him upside down. And what that does is it allows the fluid to go up to his head and helps to adjust his cranium while he swings upside down, as well as it gives us a way to look and measure his posture while he swings. Good job, Brock. Okay, go ahead and grab his head.
Is there anything inside this?
Good. Hey, bud. Is that fun? You like that? Yeah, you like that. Uh-huh. Okay, let's have you guys sit up. Let's have you put Brock on your lap facing you. And now I'm going to utilize a technique known as KST, which is core specific technique. We're going to try to identify other areas.
That's why I got that out.
What?
Yeah, because it was in between times that I got this. It was the last visit.
First, we got to do his sphenoid bone over here, real light. Does that feel good? Does that feel good?
Every year they have to read.
And his C1, which is his atlas right here, is going over to the left a little bit. Does that feel good?
This is part of our age.
Okay, and his upper thoracic area is very tight, and there's a little bit of rotation here, and this is probably affecting his breathing. He should do a little bit better after this. Uh-huh. Uh-huh. Does that feel good? You like that? I bet you do. Okay, and a little bit of the occiput on the right. Very good, Rob. Good job. Okay, now I want to get a little bit extra in this upper thoracic area right here. There we go. Does that feel better? Does that feel better? Yeah. Let's make sure you're all done. Good. And that's how little guys and girls get adjusted in our office. Thanks, Brock.